New data from the Ministry of Health's Division of Mental Health now categorizes the common mental health disorders in Uganda as epilepsy, depression, bipolar, alcoholism and drug abuse, dementia, schizophrenia, anxiety, and attention deficit or hyperactivity disorder, especially in children. While addressing the press today, Dr. Hafsa Lukwata, the Assistant Commissioner in charge of Mental Health and Control of Substance Abuse at the Ministry of Health, said the numbers of those in need of care is overwhelming.
People are beginning to inject drugs, and we know the dangers. Initially, our epidemic, the HIV epidemic, was driven by heterosexual kind of care, like a man and a woman. But now we are having people who are injecting drugs. We have the men who are having sex with men, and all those other things. And we are seeing even newer drugs, the synthetic substances. People are just mixing a few things, the gray hairs we have been telling you, people are burning bones, people are burning some grasses, their phones.
In 2024, 7,018 people were diagnosed with schizophrenia, 6,673 suffered bipolar disorder, 5,148 people had anxiety disorders, 5,134 suffered epilepsy, 4,377 had alcohol use disorder, and 4,051 were dealing with substance or drug use disorders, among others.
Just to let you know that we have over 85 psychiatrists in this country, and it is only 20 of them that have been employed by government. It's a pity. So where are the 60? We have over 300 clinical psychologists, but only 6 have been employed. And these 6 are actually, most of them are even in Butabika.
The problem of mental health in Uganda is challenging, and officials from the Division of Mental Health at the Ministry of Health are actually worried because 85% of the people who require treatment for mental health complications in Uganda cannot get it.
Most of our people will go to the shrines, they will go to the religious leaders, they will do so many other things. So there are quite a number of them out there, but this is a picture of what we see who are within our facilities.
Due to resource constraints, the division is working through partnerships with several organizations. One of such is the National Gaming and Lotteries Board, which has invested heavily in rehabilitation and awareness to responsible gaming. Dennis Mudene Ngabirano is the Chief Executive Officer of the board.
We are undertaking responsible gaming trainings with them, especially focusing on the VHTs, the village health teams, and the district health officials, so that they understand all about gaming and how we can work together so that it's part and parcel of the work they do while creating awareness.
Ngabirano says they have also tightened the noose for the operators on meeting the standards to prevent addiction.
Recently, we implemented what we call a National Central Electronic Monitoring System, which interfaces with operators, especially the online operators, and we've encouraged the operators to implement responsible gaming tools like self-exclusions. And at the moment, the statistics we are seeing, about 53 people have self-excluded themselves from betting sites for a period of time.
Dealing with the problem of mental health requires a multi-sectoral approach, but most importantly, must be funded to enable programs work. Currently, the Division of Mental Health at the Ministry of Health has only 2 paid employees and the other 4 are volunteers. The team, according to the officials, is insufficient. Walter Mwesigye, NTV.